Assalamu alaikum. Now I would like to discuss about three topics: acute stress disorder, adjustment disorder, and PTSD. Start with my intro. Can you hear this murmur? Okay, tell me in the comment box. Okay, start with this: acute stress disorder. In stress disorder, first of all, you have to remember the duration. Acute stress disorder, three words, so more than 3 days, but less or equal 1 month. So he is in stress, acute stress, more than 3 days, but less than 1 month. Exposure to actual or threatened trauma. Symptoms of the following, like avoidance of internal memories or external reminders. There may be nightmares. There may be flashback. There may be amnesia, loss of memory, amnesia for event, derealization. Am I me? Arousal. There may be insomnia. There may be hypervigilance and startled response. There may be also negative mood. The most important in ASD, not autism spectrum disorder, acute stress disorder, more than 3 days, less than less or equal 1 month, and the treatment in here, as it is due to mostly trauma, so trauma focused CBT. Trauma focused CBT. Consider medication for insomnia and intense anxiety and monitor for PTSD. If it is more than 1 month, think about PTSD. The best initial approach to provide education, the best initial approach to provide education on common physical and emotional response to trauma, avoidance, hypervigilance, and the course of acute stress disorder. Normalizing the stress response while explaining the symptoms may remit, but can also persistent distress or impairment would be. So first educate, then do trauma based CBT. Okay, next, PTSD, post traumatic stress disorder. Acute stress disorder, less acute stress disorder. In acute stress disorder, it should be more than 3 days, because more than 3 days but less than 1 month. If it is more than 1 month, then PTSD, post-traumatic stress disorder, exposure to life-threatening trauma. The important in here: nightmare, flashback, intrusive memory, evidence of the remainder and the dissociation. There may be negative mood. Look, the similar pattern of the ASD, but the duration is the must. Like this hypervigilance, there may be irritability, decreased loss of interest, there may be negative mood, there may be sleep disturbance, all similar to ASD, but the duration is more than 1 month. In here, the first line, like trauma focused CVT, and then you can give SSRI or SNRI. So, post traumatic stress disorder in children may present with distressing dream with vague content and reenactment of the trauma themes in play rather than in clearly formulated memories. They often struggle with emotional regulation and may appear easily upset and angered with a little provocation, and small hippocampus volume is seen in PTSD. Very high, small hippocampus volume is seen in PTSD, and abnormal high catecholamine in urine due to maladaptive hyperadrenergic response. Also, exaggerated dexamethasone suppression test. So, uh, also exaggerated dexamethasone suppression test, and in here there is small hippocampus volume in PTSD. So our last topic is what? Our last topic is uh, adjustment disorder. Okay, if we look at the adjustment disorder, Look, adjustment disorder, mood and behavioral symptoms onset within 3 months of an identifiable stressor. So, adjustment within 3 months. This is very high yield. Autism spectrum, anxiety, acute stress, in an acute stress disorder, it is more than 3 days but less than 1 month. And for adjustment, it is more than within 3 months. Within 3 months, but not more than 6 months. It is within 3 months but less than 6 months. And so adjustment, there is marked distress or functional impairment. It does not meet criteria for another DSM-5 disorder. Differential diagnosis may be normal stress response, not excessive, no significant impairment. Acute stress, there may be traumatic event, intrusive re-experiencing. There may be MDD, more than 2 weeks for 5 out of 9 symptoms. CGCAP symptoms. Also, you can say dick space symptom. Management is psychotherapy is the first line, but in acute stress disorder sorry in acute stress disorder and in PTSD, both cases CBT, trauma based CBT is the first line, but in here, in adjustment, psychotherapy is the treatment of the choice. Adjunctive pharmacotherapy, short term, short term are reserved for rapid relief of the impairment symptom like sleep aid and anxiolytic. And the MDD SIGI caps, or the SIGI caps are sleep disturbance, interest loss, guilt, energy loss, concentration impairment, appetite disturbance, psychomotor retardation, and suicidal ideation. So these are all about acute stress disorder, PTSD, and adjustment disorder. Hope you enjoy my video. Give uh, subscribe and give likes and comment on whatever you understand on and the murmur.